Good afternoon, everyone. Welcome to the U.S. Chamber Foundation's Path Forward series. If you're just discovering Path Forward, we're delighted to have you with us today. And if you've been joining us regularly throughout the series, welcome back. For the first part of today's program, we'll be discussing the deadly COVID-19 surge in India right now and what it means for our shared recovery. We are reminded again and again that this is a global crisis and the pandemic will not be over until it is defeated in every corner of the world. Right now, the people in India are suffering, and experts forecast the infection rate to climb in coming weeks, pushing the already overburdened health system to the brink. The Chamber has been working with President Biden and his administration and the American business community to coordinate a public-private response to aid in this crisis. If your business would like to be a part of that effort, you can find more information on uschamberfoundation.org. Joining us today to discuss what is happening in India and how we can all do our part to provide support is the Indian Ambassador to the United States, Taranjit Singh Sandhu. In the second part of today's program, we'll turn our sights back to the U.S. and discuss the critical priority of reopening schools across the country. For many kids, as you all know, school's more than just a place to learn and grow. It's also a place to feel safe and have a meal to eat. We also know that a lack of access to childcare that in-person learning provides is a major barrier keeping many parents from being able to return to work. So now with vaccines being increasingly rolled out across the country and more information about how to safely gather in person, we want to see kids get back to school and to childcare so we can fully reopen our economy. Today, we have a terrific lineup of guests to help us do just that. We're delighted to be joined by John Bailey, who is an advisor for the Walton Family Foundation. He will share new data on the safety of reopening schools, including the impact on community spread and the cost of school closures. Also joining us is Ohio Governor Mike DeWine, whose state has successfully and safely returned 95% of its students to classrooms. Given the governor's busy schedule, we actually pre-recorded that interview earlier today. And we're pleased to welcome LAURIE president of the National Association of School Nurses, to highlight the critical role school nurses have played throughout the pandemic and how schools will serve as COVID-19 vaccination sites for students and communities. We have a lot to discuss, so let's jump right in. So, Mr. Ambassador, these are certainly challenging times. And as we said a second ago, India is reporting some of the highest daily case counts we've seen since the beginning of the pandemic. It's gracious of you to take the time to discuss the situation back home. Before we begin, let me ask, how are you and your family doing? Ambassador, I think you might be muted.
Can you hear me now?
I can. So I asked how you and your family are doing, sir.
Yeah. Suzanne, we are all trying to cope with the situation. There are lots of near and dear ones who have been affected. Now, of course, we need to remember that behind every number, every statistic, there is a human story. Of course, my wife and family are very much there. It's an extremely challenging situation. However, we are hopeful that given the resilience of India and with support from friends and partners like United States, we will emerge out of this hopefully soon.
You know, I think one of the things we're all watching is that India was in pretty good shape, right? Just a short bit ago. What role do you think these new variants are playing in the devastation?
No, I'm not a technical person. However, specialists in the field, they ascribe it to different variants. The UK one, the South African variant, and the double variant strains, which have very high infection rate compared to the earlier ones. And there has also been opening of the economy. But you must also remember that this pandemic comes in waves. At any point of time, some country or the other is suffering and facing the surge, be it in the United States, UK, Italy, Brazil, Europe, etc., etc. It is in that sense truly global in nature. We still have not been able to tame the virus in that sense. Important that, sorry, go ahead.
No, please.
No, that's fine, as far as that is concerned.
I think, Mr. Ambassador, as it became more and more clear to the United States and to your friends here, what was going on the ground there, the United States as a whole became concerned, both on the humanitarian level, also on a business level, especially because of what an important ally your country has been to the United States. And so I think also, when we were at the worst part of our pandemic, India stepped in to help us. And so now, as we're mobilizing to try to return the favor and be helpful, what do you think your government needs the most from the United States, from the business community, from your other friends around the globe?
Firstly, let me underline that Government of India deeply appreciates the swift response of the US business community. I understand that even as we speak, additional supplies of medical equipment are being dispatched to India. The manner in which US Chamber of Commerce particularly has mobilized support, brought together partners from other industry bodies, coordinated with the US government, and delivered the most critical items has been tremendously heartening. There is symbolic of the deep linkages that connect the two countries, the people-to-people ties, and of course, an affirmation that in time of crisis, our countries will stand together. A number of top US companies have also reached out to us, announcing support. Now, these gestures are very widely appreciated amongst the leadership in India. Given the crisis we face, the most critical items relate to oxygen devices, that is oxygen concentrators, cylinders, carriers, ventilators, and oxygen generation plants. We have also critical requirements of the COVID-19 related drugs, such as remdesivir and other variants. We are also working with a number of US companies to identify and source these supplies.
Yes, I think that's right. And I would remind our audience that at uschamberfoundation.org, there are a lot of ways that you can help. We've been spending today in particular rounding up ventilators and funding for ventilators. But as you well said, the weekend had to do a lot with oxygen and figuring that out. As you know, I think the U.S. Chamber called last week for the Biden administration to release the AstraZeneca vaccines. And they did announce over the weekend they would do that. When do you expect to receive them?
We again, as I mentioned earlier, we are very appreciative of Chamber's efforts. And what this devastating pandemic has shown that none of us are safe until all of us are actually safe. So vaccination is a priority, and any additional vaccines we receive will take us closer to that goal. Now, as you know, that Indian vaccine producers are doing their best to ramp up the production in line with domestic and international requirements, which will ensure widespread vaccine availability. Now, as for the US doses, I understand that there is some quality checks and other procedures that are being followed before the release of the AstraZeneca vaccines. We are working closely with the US government to see whatever is possible. And I would just mention here, please do not forget that India did supply more than 66 million vaccines around to 95 countries of the world. We have always worked for ensuring global health and well-being.
Yes, that's right. And it's an important reminder. You mentioned Indian vaccine manufacturers, and that makes me want to ask how you're doing in gaining the raw materials that those manufacturers need.
Suzanne, the US government has assured us of raw materials for vaccines under production, especially Covishield. They will make these available immediately. Our healthcare partnership with the United States has been extraordinary. And as the president himself noted, just as we stood with the US in the early part of the pandemic, the United States is standing with us now. Yesterday night itself, the first 2 consignments of US medical supplies took off from California, and more are on their way. This is true partnership in action, and we are hopeful the other aspects will also fall in place.
Mr. Ambassador, before you go, and as I said at the outset, it was gracious of you to spend time with us given how busy you are. Before I let you go, let me ask you one final question, and it is, you're speaking to a large business audience, you're speaking to state and local chambers across the country, other foundations. What can other parts of the world learn from this surge in India? What do you want to say to people around the globe about what they should be thinking about?
Let me say this, this pandemic is ongoing and we must adjust our lenses constantly to deal with the emerging situations. What may have been true a year ago, 6 months ago, or even a few weeks ago may no longer be relevant, whether it is in protection and containment strategies or treatment approaches. Ultimately, what is crystal clear is that we are all in this together. Our global challenges, whether in pandemic control or climate change, we need urgent solutions that require countries to come together quickly and effectively. As a responsible partner, as I've mentioned to you, India has participated earlier. We have supplied large number of vaccines around the world. While we face this unprecedented emergency situation, we are confident that we will soon come out of this and be back as a contributing effectively to global health and well-being. And India and United States have always stood shoulder to shoulder in these efforts, and I'm confident that we will overcome this present challenge with determination and resilience. And just to answer your question again, that this is a learning process for all of us, and we need to come together, put our minds together, and face this challenge together.
Mr. Ambassador, I think it's such an important point that we have to work together as friends and allies, as we always have. We have to learn as the virus grows and our knowledge grows. We have to count on science to get us out of this. And we know that the private sector has a major role to play in getting us to health. I think the most important thing you said is that not one of us is healthy and safe until we're all healthy and safe, particularly with this virus. Mr. Ambassador, thank you for your friendship and thank you for your time.
Thank you, Susan. Personally to you and to your chamber, we deeply appreciate what you are doing. Thank you very much.
Thank you very much. Now, let me bring in John Bailey, the advisor to the Walton Family Foundation. This is, again, the theme of today's show is actually reopening the schools, but given the urgency of the situation in India, we took a detour to get back to U.S. schools. So I want to hear more about, you've published a really important report about reopening schools entitled, "Is It Safe to Reopen the Schools?" So tell our audience about that report, what you learned, and what it says.
Wonderful. Well, thank you so much for having me today. And just again, hearts in our empathy goes out to India. Really, COVID anywhere is a threat to us everywhere. And we're seeing that with variants. And it's so important for us as a country to really do all we can to help the people in India, the people in Brazil, and other hotspots around the world right now. A little bit about our report. This was a remarkable collaboration with the COVID Collaborative, the Walton Family Foundation. We had a bipartisan group, center right, with AEI. We had the United States of Care, which Andy Slavitt, who's in the Biden administration right now, helped found Opportunity Labs and the Evidence Project. And what occurred to us a couple months ago was that there was this amazing body of evidence, of studies that were emerging over answering a lot of questions around risk and to children, and risks to schools, the risks to communities as it related to COVID. But no one had sort of collected all those and published those in one place to kind of give a roadmap for community leaders, for business leaders, and for school leaders to sort of interrogate the evidence themselves and come to their own conclusions. But it's pretty remarkable in that what we've learned over the span of a year really has shown a bit of consensus that the threat of COVID to children is far minimal than we thought this time last year. This time last year, we were playing with a pandemic preparedness playbook that really suggested respiratory infections offer the most risk for kids. And so that's one of the reasons you close schools, is to protect children and also to slow the transmission of the virus within a community. What we've learned, what research has been sort of pointing to us, about 130 studies that we summarize in this report, is that kids tend to be the least at risk for the virus. It's not zero, but it's much, much lower than older populations. And also the transmission of the virus tends to be a lot less with kids under the age of 10. There's still some open questions with teenagers as to whether or not they transmit the virus at the same rate as adults or somewhat less. But what we've seen is that when you reopen schools, you bring kids back with the appropriate health protocols, that it's not creating a surge of spread within a community. And that should be very hopeful for us, that what we've seen with school reopenings in Europe, and frankly, a lot of school reopenings here in the United States, that there is a way to do this now, not wait for next year, but to do it now, and put in protective measures to make sure kids are protected, but more importantly, teachers are protected as well.
And so what are those protective measures?
Well, so the way to think about this, epidemiologists talk about the Swiss cheese model of protection. And the way to sort of think about this is that each type of protection, wearing a mask, getting a vaccination, keeping some distance between each other inside of a classroom, is one layer of cheese. And none of those layers are foolproof. They all have a little hole in it that the virus can get through. So what you need are multiple layers of risk mitigation measures in order to protect teachers and protect kids. Fundamentally, masks have just been amazing at slowing the spread of the virus. We've also learned keeping kids somewhat spaced apart is particularly effective and powerful. What we've also learned is that originally we thought you had to keep kids apart 6 feet inside of a classroom. And we were so, I think, grateful that the CDC took a look at all the research that's been accumulated and experiences of schools that have used less distance, 3 feet, and that have been able to do that and not keep the 6 feet, but still have very low rates of transmission inside the classroom. And so that's important. And then obviously increasing ventilation with air purifiers, opening up windows, fans, upgrading HVACs. All of these are super important in order to make sure that kids are protected and teachers are protected. In fact, what we've seen from around the world is that when you have an outbreak at a school, it's often because one of these health measures wasn't followed. That was true with a Georgia summer camp where a bunch of kids got infected. None of them were wearing masks. It's also true with another study that came out of Israel with a high school, a series of high school students that caught the virus. And it's because none of them were wearing masks and they were recycling air as opposed to bringing in new air because of a heat wave that was like going over the country around that point. And so that's good news that these are again, measures that have been put in place with many schools throughout the world, but also here in the United States, going as far back as last August and September. And it gives us a roadmap for how to reopen schools now and for next year too.
You know, we've heard from a lot of people exactly what you're talking about, which is in some ways it's easier to have those protections in place for kids when they're at school because there are adults enforcing them, because they're sitting at a desk, that it was a little harder to enforce, say, for teenagers even when they're not in school. Right, that they're able to run around. It's harder to patrol the masks. And so at least school's a controlled environment, right?
No, that's exactly right. And in fact, what we're finding is that many of the infections with kids are happening in households, not at school. A CDC study looking at Florida found that out of all the pediatric cases, children that have caught COVID, only 1% of them were linked back to an in-school transmission. Most of them are at home because, again, kids are closer together at home. They're not wearing masks. There may not be as much air circulation. And so actually reopening schools is an extra sort of protective measure for communities and for those kids. But you're absolutely right.
And it's interesting, right? Because as we're weighing the costs of keeping kids home, your report started talking about, okay, there's the health cost and there's the health risk, but there are other costs and other impacts of keeping schools closed. Can you talk to our audience about that?
Yeah, I mean, I think all this, I want to, we have made this school reopening debate such a polarizing issue. And it is a difficult issue. It's been a difficult issue for governors, for superintendents, for teachers, for parents, for community leaders, because it is weighing trade-offs. And what we have to do is weigh the public health benefits, whatever public health benefits you get from school closures with the costs. And we were able to sort of find some studies that outlined 4 different costs. First, there's the most obvious, which is learning loss. And that is where students should be at a certain point with their academic lessons and materials and progress, and they're not, they're behind. And we're just seeing a series of reports coming out that have estimated that kids are 3 months, 4 months, or even in some cases a year behind where they should be. It is going to look very different in different parts of the country for a whole variety of reasons. Online learning was great in some areas, poor in other areas. Some schools have been open since September, others have been closed since September. So this learning loss is going to be different in different parts of the country. It's one of the reasons we need assessments, and the Chamber has been such a good champion of making sure that we have assessments so that we can understand the depth and breadth of learning loss that's happened over the last year and use that data to inform our recovery strategies going forward. The second is that today's learning loss becomes tomorrow's earning loss. That we just know that if students are behind and are not able to catch up, that impacts their college aspirations. It impacts what they make once they enter the workforce. And we have seen estimates from Opportunity Insights as well as McKinsey that those earning losses can be $66,000 to $100,000 over a lifetime, even greater for communities of color. And so super important from a workforce standpoint that we address that quickly as possible. There's the mental health challenges that we are seeing spikes of children's depression, anxiety, and kids getting hospitalized with suicidal tendencies or thoughts around the country, in San Francisco, in Nevada, and a number of different areas too. Again, we don't have a good sort of national set of data yet to give a sense of how bad this is, but some kids have gone through a lot of trauma with losing loved ones to COVID. The social isolation has just wreaked havoc on them. We're going to need a strategy to help make sure kids can just be kids and start socializing and address some of these challenges that they've been facing. And then lastly, there have been costs to mothers. What we have seen, and you heard President Biden talk about this last night, that there's been 1.7 to 2 million mothers that have left the workforce. And they've left the workforce, what we're seeing through a number of studies, because of them needing to stay home because of remote learning. And so it is super important for us to get schools reopened, not just for kids, but to help give mothers the chance and the option to go back in the workforce. But those are just 4. I know there are others that are out there, but those are 4 that we highlighted in the paper.
And so important, right? The learning loss, how it translates to earning loss, lost opportunity, the mental health costs. I mean, they're all so important. And I think really your paper is so important and it's been such a tool for people. And let me ask you a question about that tool. You know, we're going to hear from the governor of Ohio next about how he's done in reopening schools, and they're pretty far along, and it'll be interesting for the audience to hear that story. But as people are listening here that may live in communities where the schools are not as far along in getting back to in-person learning, what message do you have for them?
Well, there are 2 messages. One, use this paper, use the 130 studies to help provide evidence for not just the case for reopening those schools, but for how to do it safely. We point to a number of different strategies that are research-based, they're evidence-based, to help protect teachers. Because at the end of the day, that's what's really holding up the reopening of schools right now, is a fear that by reopening schools and teachers coming in, that somehow they will be infected and they're putting their lives at risk. And so we have to give extra reassurance that teachers are being protected. And the second is that I just want to acknowledge that the paper we produced is a head argument. We're producing a lot of data, a lot of studies, but at the end of the day, the decision that a lot of families of color are making is a hard decision. And they're trying to evaluate the risks of sending their kids to school who may catch a virus and bring it home to them and their extended family. And we have to understand that that's a heart argument as much as it's a head argument. And we have to engage them and give them other alternatives to continue in online learning until they feel it's safe to come back to school. But it's not a reason to keep schools closed. It's a reason to give parents more choice, more options, and frankly, more power in terms of how their kids are educated.
And that, again, those are really important points. On this series, a couple weeks ago, we had a really talented woman who was running a assisted living home here in DC. And she talked about the fact that her employees qualified under the EEOC definition of essential employees, and she could have required them to get vaccines. But she instead chose to meet them where their hearts were and really help try to understand what it was that was holding them back, and almost person by person walk them through the YouTube videos explaining the science or explaining the side effects. And I think you're right that this is going to take a little more empathy and really meeting people where they're living on a case-by-case basis to get them back. And it's so important.
That's absolutely right.
I really appreciate you being with us today. We're going to bring you back in for some audience questions at the end. But for this moment, we're going to take a second and roll the interview we did earlier today with Governor Mike DeWine of Ohio. So, Governor, as you may know, I'm a proud Ohioan, having been born in Dayton, and so I'm concerned about my fellow citizens. How have Ohioans fared during the pandemic?
Well, it's been tough for Ohio. It's been tough for every state, but I think we've tried to keep the balance so that we protect lives, and we felt that by protecting lives, that that allows our people to go about their business, our economy to continue to move. And so, we're now in the phase of vaccinating people. We're about 40% of all Ohioans have now been vaccinated. Those above the age of 65, I think we're at 74% now. So it's coming. It's coming.
What have the challenges been to that vaccine rollout?
Well, we sort of hit a wall about 2 weeks ago. And, we could see it coming. We knew that there would be a date when we would have more supply than we had demand. But about that same time when we thought that was going to occur, of course, you had the pause in Johnson & Johnson. And so those two things together, I think, really has slowed it down. But we're seeing a pickup now in Johnson & Johnson. There are people who really want that one shot. That's what they want. So, from a marketing point of view, there's 3 vaccines, and some people want the Johnson & Johnson, some want the Pfizer, some want the Moderna. So we're in the position now to give them whatever they want. We're also working now with businesses, something we were not able to do early on when we had to ration the vaccine. But now we can tell business, we can come into your shop floor, we can come into your factory, into your warehouse, and vaccinate anybody in your business who wants to be vaccinated. We've even had some companies who have invited family members to come in. So we have the ability to do that now, and we're working very closely with all the business groups, and I think that's working.
It's interesting that you say that, because it strikes me as just fantastic news. We know a lot of big employers who are eager to further be part of the solution, right, and getting their employees vaccinated. So that's great news. The other thing we hear a lot from employers is the importance of getting schools and childcare centers open. Another thing that you've done very well, Governor. So let me start, that's the focus of today, is getting the schools reopened. So let me start by asking you to take us back in history to kind of the beginning. How did you make the decision to close the schools and go virtual?
Yeah, I think we were the first state to actually announce that we were going to close the schools. And we did that based on the medical advice that we had at the time. And, this has progressed. We had a tough decision last summer to make in regard to opening the schools the next fall, this past fall. And we are as you know, a very local government state. We have over 600 separate school districts that are run by the local school board and the citizens. And we respect that a great deal. So what we did in opening the schools back up is schools could open in any way they wanted to. They could do totally remote, they could be a hybrid combination, or they could be all in person. We've had schools, in all three areas. One thing that we were able to do really ahead of the federal government during the winter was we started seeing kids who were in school, who had been exposed in the classroom, And the CDC guidelines were telling us they had to be, quarantined for a couple of weeks. But then school principals started telling us, look, these kids are not getting sick. None of them are getting sick. And so we actually then went in and did some testing in our schools. And to make a long story short, we found out that in the classroom, when everybody is wearing a mask, even if they're 2 feet from each other, 3 feet from each other, that there just wasn't any spread. And so we relaxed the guidelines and basically said that if you're in the classroom and Johnny is next to Mary and Mary's got the COVID, but everybody was wearing a mask, we're not going to require you anymore to be, separated from school. And that was a big thing. It was based on the testing that we did, plus the reporting that we were hearing from the local schools. The next big thing that we had to face is, we had some kids who were in school. Most of the rural schools, for example, the kids were in school 5 days a week. Most of the urban schools, our bigger cities, they had opted to be totally remote. And it became clear after a while that some kids just were not doing very well in that total remote situation. So what we did, once we found out the vaccine was coming, we made an announcement and said if the school would agree, if the superintendent or the CEO would agree, actually we had them sign a document to go back in session, either hybrid or totally in person by March 1, that we would take the month of February and we would vaccinate everybody in your building who wanted to be vaccinated. Every school in the state except one took us up on that offer. And so we spent the month of February vaccinating any school personnel who wanted to be vaccinated. We went through all 600 and some school districts. And virtually every school was back in session by March 1. We had a few that were kind of lagging and they got back in a week or 2 weeks after that. But just to compare it, January 1, we had half our kids totally out of school. By the time we hit that March 1 deadline, I think we were up at the 93, 94%. Today, we're at 99% of our kids are back in school. So it was kind of a incentive. We had one school, that was really slow going back. And I said, look, we're going to have to stop vaccinating your employees. We were vaccinating them that week. And I said, look, we can't do this anymore. The deal is that you're going to go back in session. So it has worked exceedingly well in Ohio. And, our teachers, our principals, our school personnel, superintendents have done a phenomenal job throughout this period of time. This has been very tough for them. It's been tough for students, tough for parents. But I think everyone's done a great job. We made the decision early on last summer that any kid that went back into school, they needed to be masked the entire time. And we really attribute that to keeping the spread down. We're just not seeing spread coming from the classroom. Now, you do see spread coming from what kids are doing outside of class, outside of school. So I'm not saying we didn't have spread, but in the classroom itself, everyone wearing a mask, and they've done it phenomenally well. We just were not seeing the spread. That was a great thing.
I think, underlining two things that you said. One is, when this all started, none of us had ever seen anything like it before, right? And so the shutdown, the lockdown, while we figured it out, felt really important. But I really applaud your ability to listen to the experts and iterate as you went based on the experience you were actually having and bringing people along with you so that they had confidence. But let me ask you to double down on something, because you made a really important decision to say that in-person learning was important. Was that because you were seeing learning loss? Did you feel like you had to mitigate that? I mean, what made you say, yep, in-person learning matters so much that this is what we're going to prioritize?
Well, we pride ourselves on listening in our administration. Seriously, I can't tell you, my wife can tell you, she would claim that everybody in the state of Ohio, 12 million people have my personal email. But, I was getting a lot of feedback, and, it was parents who were saying their kids were having mental health problems, lack of socialization. I was hearing, from principals. I was hearing from superintendents. So we got a lot of feedback from a lot of different places. And, we have kids, Fran and I have children who were fully remote. We have other kids who were fully in person. We have some who are hybrid. All these are our grandkids. We have 26 grandkids of different ages. And so, we would kind of see from what was going on with them. And the reality is that some kids did very well remote. In fact, some liked it. Some thrived on being remote. But there are also a lot of children who did not. And, the ones who maybe were behind before got farther behind. And these are the kids that, frankly, I worry most about. We worry about all our kids, but a lot of kids are going to do okay because of many different reasons. But kids who are already behind may not be able to have that internet connection, for example, may not have sometimes the parental support. Maybe parents are working 2 jobs. So every child is different. And it was clear that we needed to get kids back in school, particularly kids in our urban settings who were the kids who had not really been in school. We had kids who had not been in school for virtually a year. And there's just a lot of downsides to that. So we needed to get them back in.
I like the DeWine 26 kid personal focus group. That's pretty good.
Yeah,
So
it works really well, actually. You got great diversity for these families.
good continuum there. So Ohio's in the middle of your K through 12 academic testing right now, as I understand it. How will you use what you learned there to think about next year and the kind of academic catch-up that might be necessary?
I think it's important. We are, as I said, a very local school district state. We believe in it. And what these tests do is give parents, gives school officials data. And, they take that data and utilize it. So this is a very unique, obviously a unique year, a once in 100-year situation. The good news is that the federal government has supplied a lot of money. We have billions and billions of dollars coming in directly to our schools in Ohio and across the country. So that money can be used by schools to compensate, to help kids get caught up, whatever these kids need. And so I ask all the school districts, superintendents, to come out with a report to their parents, to their local taxpayers, local citizens, and kind of outline. And we asked them to do this by April 1st, and to outline what they were going to do to compensate for these kids getting behind. And what I wanted to do is just start that discussion at the local level. Now, the legislature's looking at it, we're looking at it, but ultimately, this money is going down to the local communities, and the local communities are going to make the decision how this money is spent. And it's imperative, I believe, that they spend it on kids who are the furthest behind, kids who have been hurt the most by the pandemic. Those are the kids who have got to be part of our society. They've got to be able to live their American dream. They've got to have the ability to dream dreams and have the ability to carry those out. So that's what we're asking our local school districts to do, is to have that discussion, to have a candid discussion with the people of the community. This is what we need to do. And there's many ways they can spend this money. They can spend it on tutoring. They can do things in the summer. They can target certain kids in the summer. There's all kinds of things that they can do, but we wanted them to have that discussion. And most of them are already having that discussion. I mean, these are very responsible people. These are people who care very much about kids. But we want to make sure every school district was having that discussion. And because the money is there. The money is there, and we have the ability to use that money in a kind of a one time to get these kids caught back up, or to do the best we can to match whatever the deficiencies are and try to compensate for those deficiencies.
So important. The number one thing I hear from CEOs is about a worker shortage and the need for education and the need for training. And so important that this wasn't a lost year in so many ways. So Governor, I know we have to let you get back to your day job, but let me ask you one last question. And that is, you're right. It was a once in 100-year situation. It's been difficult on everyone in different ways. But I like to ask all of our guests, what makes you optimistic about the future as we start to come out the other side here?
Oh, I'm very optimistic. Look, I think, first of all, there's great pent-up energy, pent-up desire to travel, pent-up desire to go to restaurants, to go to ball games, to go out and do all kinds of different things. So I think from the part of our economy that's been hit the most, our restaurants, for example, our bars and other retail establishments, there's a great desire for people to get out. In Ohio, we've got 40% of our population that's now been vaccinated, and it's available. And so we just continue to encourage more and more people to get vaccinated. It really is our ticket out of this. I look at Ohio. Our economy is strong. Our economy is good. I'll put a little promo in for Ohio. This is the place to come to live. This is the place to raise your family. This is the place to come to start a business. We got a lot of good things going for us in Ohio, and we would invite anyone watching this who's thinking about relocating, come to Ohio. We would welcome you. We keep taxes at a good rate, and we've got a very good state that is looking to the future.
Well, that was a fantastic wrap. We'll let you get back to taking good care of Ohioans. Take special care on Dayton for me. I have a nephew at UD right now, so keep an eye on Dayton for me, Governor. And thank you so much. I think these lessons will be important to other states, to other governors, and to employers as we think about how to open businesses and open schools and get our country back to health and back to economic health. We really appreciate your time.
Suzanne, thank you very much. I appreciate it. Good being with you.
Now we're delighted to welcome LAURIE COMBE. Who is the president of the National Association of School Nurses. LAURIE, thanks for being here. Help our audience understand the role that school nurses have played in schools and in communities across this pandemic.
Well, Suzanne, thanks for having me today. Of course, everyone wants to know what school nurses have been doing during COVID. But first, I'd like our audience to understand the important work that school nurses do every day to support the mental and physical health of students, as well as their academic readiness. We manage chronic health conditions, detect early warning signs of mental health issues, and then we intervene to ensure appropriate care. We level the playing field related to health disparities. We promote healthy behaviors across school populations. We amplify the voices of students and families and work tirelessly to see that their needs are addressed. Across this nation, school nurses in many school systems have led pandemic response, advising plans for the dissemination of learning materials and nutrition while schools were closed, maybe helping to figure out how to push broadband access into underserved communities. They are helping make decisions based on accurate public health data. And as our speakers, John Bailey and Governor DeWine, had pointed out, that's ever evolving. And so keeping pace with that ever evolving data. They're providing health education to their communities, talking to them about these layers and layers of mitigation processes that really support that safe return to school. And I want to emphasize that it is important for students to be in school because, yes, they get great socialization. They need to have access to that in-person learning. I want to say that additionally, school nurses in their direct care of students and the population are managing assessment of those presumptive cases, isolating those students as necessary, maybe even staff as they're waiting for someone to transport them home to quarantine. They're conducting tracing and testing, and in some cases, they're vaccinating.
It's quite a list, right? They've been really busy. Let me ask you a question. John Bailey talked about his report, and Governor DeWine seemed to say this too, which is that the actual transmission in schools seems quite low. Does that match the experience you're hearing about?
Well, it does. I work here in Texas, and schools have been in person since September of 2020. And just as your previous speakers have said, where mitigation processes are followed, transmission rates have been low. That primarily rates of transmission amongst students has been related to athletic groups. But even outside of a pandemic, that's not abnormal because it's a large group of students in close contact with one another, participating against other teams in close contact from other areas of the community. So it's not surprising that if we've opened athletics, we see that. I've heard similar stories from around the country. I think that we don't know everything we need to know about the possible spread from asymptomatic children. And some schools are addressing this. Governor DeWine spoke to the process in their schools. Some schools are using pooled testing of student cohorts. And then if that pooled test shows a positive test or a positive PCR test, then all the members of that cohort are tested individually to identify who might be the index case. My concern moving forward is that there is rising sentiment to move away from many of these mitigation efforts, such as masking and isolation and quarantine. So I think when we think about vaccine, we have to remember no vaccine is 100% effective. Generally speaking, population vaccine rates between 80%, which is necessary to protect for polio, and 95%, which is necessary to protect for measles, stem widespread disease transmission. And this varies by disease, as I've just pointed out. While the experts say we don't yet know what the herd immunity level is to protect communities, what we do know that only 30% of the US population is fully vaccinated, 43% have one dose, and we don't know if those vaccines will fully protect against the variants, although there is some emerging evidence to say that there is some level of protection.
Now, as you mentioned a minute ago, one of the roles that school nurses have played is actually vaccinating children. And I know Denver is an example of a place where school nurses have been vaccinating kids that are 16 and up. And I think our audience would love to hear more about that and whether you think that particular role for school nurses will continue as we head towards the fall and the beginning of a new school year.
Well, you're right. The Denver public school system is rolling out vaccinations in schools. And as I read about it, it's voluntary for students and staff, and they have a partnership with a local children's hospital, and families can make appointments to travel to that location for their vaccines. And then they also have a local school-based health center that can provide those vaccines within schools. I think it's important for your audience to also understand that a school-based health center and a school nurse are two separate entities. In fact, NASN and the School-Based Health Alliance are working on a joint statement that we hope will be released in short order. And it notes that those two entities have very distinct and complementary roles as it relates to student health. So while school nurses may not be administering, school nurses as I speak of them, may not be administering vaccine in those schools. We know that that is happening in other areas of the country. For example, in Alaska, their school nurses have been Vaccine for Children providers for years. And Vaccine for Children is federally funded vaccines that the CDC supplies to those providers who are approved for that program. And so their plan is to administer COVID vaccine as it becomes available to them as providers, and will administer to students as allowed by the emergency use authorization. I have a colleague in New Mexico. They used CARES Act funding to purchase an RV, and they've taken it out directly into their neighborhoods where students and families live. And they're waiting approval for delivery of state-mandated vaccines required for school attendance and hopefully COVID vaccine.
Let me ask you kind of a lightning round question before we ask some audience questions. And it is, you mentioned polio and measles, and it was pretty common at one point in our nation's history for schools to administer those vaccines and to be on top of that. Do you think there were things we learned at that time from administering vaccines that apply today?
Well, I remember going to the school cafeteria and eating my sugar cube for the polio vaccine. So that certainly dates me. What I can tell you, based on history and data, is that where school nurses are present in school, vaccine exemption rates are much lower because school nurses are trusted healthcare providers in those communities, and they can educate parents about the facts related to vaccine. School nurses remove barriers to vaccine uptake. We talked about how many school nurses administer vaccine, about 14% nationwide. And really, that's limited by vaccine storage capabilities and workload considerations of school nurses. But 98% of school nurses are monitoring compliance with not only state-mandated vaccines, but recommended vaccines and providing their school community with information about that. When we can provide vaccination in schools, it increases access, it improves the equity in access and uptake, and it has the ability to address vaccine hesitancy. 41% of school nurses engage with vaccine partners. I did that all the time when I was on a campus. I had either a public health provider who would come because we had a measles outbreak and provide vaccines in schools. But I also had a for-profit provider who charged a very, very minimal fee for vaccine. But my agreement with that provider is you're not allowed in my school unless every student who wants a vaccine gets a vaccine regardless of their ability to pay. And we had a long-standing relationship that really freed parents. Parents could consent without having to leave work, without having to lose wages. We've talked about the loss of wages due to COVID vaccines. So if we bring it in-house, we drive equity and access despite ability to pay.
A lightning round. Thank you for that. Let me bring John back into the conversation too. I know we only have a few more minutes, but we do have some audience questions. And John, I'd like to start with you if I might. One of the questions we have here, I'm going to read it, is as parents and employers, how can we approach our schools and local leaders with this data? Both specifically, how can they find your report? And generally, what advice do you have to offer?
Great. Well, you can just Google the report. It's also on the AI website. It's on the COVID Collaborative website. And then it's also at the Center for the Reinvention of Public Education, CERPI, the Evidence Project. But you can just Google it as well. And then I would just share it with your superintendent. Super important to share it as a way of just helping to inform them. We went to great lengths to not just present the data for reopening schools. There are some studies that are outliers, frankly, but there are still studies on there that do exercise and suggest some caution. But we give links to everything, and what we do is we invite superintendents to look at the reports, study what the studies and the research is saying, and then come to their own conclusions. And so, but that's what I would go to the AI's website, SERPI, or COVID Collaborative.
And would you advise a parent or an employer to use that and go straight to local school leaders and have this conversation?
I mean, absolutely. Parent voices have never been more important and frankly, more vocal in a lot of this. And what we've had is a lot of parents that have had very passionate arguments for wanting schools open, but they haven't had the data. And this gives them that. And the same thing from the business community as well. There's another mechanism too, which is right now is one of the requirements for the American Rescue Plan, the big stimulus that just passed 3 weeks ago and is pushing billions of dollars down to schools. The schools have to put up a reopening plan on their website and get public comment from business leaders, from civil rights community, the civil rights community and civil rights leaders and parents. And that's going to be another mechanism by which you can engage and help make your voice and preferences heard as business leaders, as parents, or just as community members on what's best for your kids and for your schools.
Such important advice. We really appreciate that. And Laurie, here's a question for you, which is, this is a question the audience is asking about kind of all these disinfection procedures that we've put in place due to COVID. And it has some of the virtual learning or the hybrid learning given schools more time to disinfect and clean. And how does that change if you have all the kids back 5 days a week?
Well, I know that school districts really ramped up early in the pandemic with cleaning surfaces frequently, lots of surfaces. And we worked with them and our partners at the Healthy School Network to make sure they were using safe cleaners. I think that what's important is that proper hand washing is always a great way to prevent the spread of illness. John's talked about the need for improved ventilation because we know that this coronavirus is airborne and transmitted that way. And so the word I am hearing from the field is that schools are relaxing a little bit on their surface cleaning, not abandoning it, but focusing their efforts in other areas to support mitigation.
Thank you for that. I want to thank you both. I wish we had more time. I think the information you've provided is really important to getting schools reopened, which is really important to getting workforce reopened, employers back at work, back to economic health. We really appreciate your expertise and your time. Thank you.
Thank you.
To all of you for tuning in, I want to say thank you to you too. If you want to hear more about our work on the learning aspect, on the workforce challenge aspect, on the work we can all do in education and upskilling as part of this recovery effort, you should tune into the Foundation's Talent Forward series that's going to launch on Wednesday, May 18th. They're going to cover everything from diversity to upskilling to reskilling to the role of childcare and the workforce imperative. It'll be a great series as only this talented team can put on. I hope you'll join us. If you have missed any of our previous Path Forward episodes, you can find them on YouTube or at uschamberfoundation.org. Our next episode live will be Thursday, May 13th. In the meantime, stay safe, get your vaccine when you can, and we'll see you very soon.